Welcome back. In this section, we're going to talk about incorporating your laser further into your dental practice. Now that we've gone over the initial setup of how you use the laser, we're going to get into actually cutting with the laser. We'll also go through setting it up again, the functions of the laser, to reinforce what you've already known. But we'll go through initiating and how to use a tip at different power settings, whether it's cutting properly, fast enough for you. We'll do that on a model utilizing a pig jaw. As we advance through this part of the training, this will help prepare you for the next part, which will be actual live patients, in which we utilize a laser and then do a voiceover so you can see the settings and technique used to get the cut or how the result you want. So, like I said, we'll go through different power range settings so you can see different cuts the laser's making. We'll go through what a properly initiated tip is, what an improperly initiated tip and how it doesn't cut can be seen. We'll go through pulsed, continuous settings, all the different variables that can help you achieve a most efficient result of your laser. Let's go ahead and just review a little before we start to actually use the laser to interact with some of the tissue. First, we have our warning sign, which needs to be posted outside of the operatory. Make sure that's properly posted. We have wavelength specific glasses. This one entails the 810 wavelength. That'll be used and worn by everyone in the operatory. And then let's quickly just review and go through the laser's use again. We have our switch and back on-off switch, and then we're going to turn the laser on by turning the key into the on position. That'll bring up our screen. We have our power level, which is just easily adjusted up or down with touch of a button. We have our aiming beam intensity, again, different levels should be shown by just pressing. We have our mode, which is either our pulsed or continuous, and that's easily changed. And then our programs, we have 4 different programmable settings that we can save. By saving a setting, just go to whichever program you want. In this case, let's go to program 2. Say we want a pulse setting at 1.5. That's all you have to do. If we go through that again to program 2, you can see it comes up as 1.5 pulsed setting. Very, very easy to use. Our emergency stop button will turn the laser off. To reset it, just press it again. We're going to either retract or extend our fiber. In this case, I want to extend it a little bit, and we're going to talk about cleaving a fiber. Okay? If you can look at the fiber is composed of basically a glass fiber that's encased in a plastic coating. The plastic coating is going to protect the fiber. If you extend too much of that glass fiber without the plastic coating, it is actually weakened and there's a greater chance of breakage. So how much fiber do we need? Well, let's go ahead and put it through our handpiece. Just thread it through. And we'll take our plastic tip off for a sec. Then slide our plastic tip on. The fiber through. Now, as you can see, we can adjust the length of how much fiber is exposed. You don't need but a couple millimeters of the actual glass fiber that's exposed, but you might want to extend the plastic coated part out according to what type of procedure you're doing. If you're doing a surgical procedure, you just need a couple millimeters extended out. And if you're doing a perio procedure where you need to get into a deeper pocket, you might want to extend the fiber just a little further. Now, when we talk about cleaving a fiber, what we're talking about is actually cutting away some of that glass fiber. After each use, we need to cleave and remove the used portion of the glass fiber. If the glass fiber becomes too close to the plastic coating, we need to remove some of the plastic coating. Okay, so we strip away some of the plastic coating by extending the fiber out the end. Going to use this little stripping instrument. We can place it in, actually measure it, pull it tight, and pull back on it. And you will actually remove the plastic coating. Now in this case, I removed quite a bit of the plastic coating because I wanted you to see how much that took away. In order to actually cleave the glass fiber now, we have a pen. We just place that, just a slight rocking motion over the glass fiber, and it will snap away, and as you can see, I removed it. Now, if we wanted to make that even shorter, we could cleave it again. A few rocking motions. I'm not putting a lot of pressure on that. It's just enough to make a little mark, and in this case, we've cleaved it back and just exposed a few millimeters of the glass fiber. If you're doing a surgical procedure, that's a great amount of glass fiber. That's all you need to interact with the tissue. Now, if we have a fiber and it's not initiated, that would be what's considered a cold laser. A cold laser does not have the ability to cut. The energy is being dispersed out the end of the tip, and it's not focused and it's not energized to create the heat that's needed to vaporize tissue. So if we turn the laser on and we go to the ready mode, so once in the ready mode, now I'm going to step on the pedal. This is a non-initiated fiber. As you can see the laser firing, you can see in a non-initiated mode, it's having virtually no cutting effect on the tissue. Okay. Well, let's go to a continuous mode. As you can see, even at 2.3 watts, continuous mode, we're having virtually no effect on the tissue. So what is initiation and how do we do that? Initiation, a good way of talking about initiation is it is the actual process of impregnating that glass fiber with some sort of pigmented material. Remember, your diode laser seeks pigment. And if we can incorporate or impregnate some pigmented material into the end of that tip, in a way it energizes that tip and it turns it from a cold laser to a hot laser. So as you could see, even at a higher setting, the laser is having no effect on the tissue. Now, just as a side note, I want you to see how we can adjust that aiming beam. We can turn it up to very bright, or we can turn it off. When would we want it bright, and when would we want it very low? If you're doing a surgical procedure, you might want it very, very low because it gives you better visualization of your field. If you're trying to do a surgical procedure and you turn this all the way up, you can see it sort of interferes with the tissue and how you can visualize it. Whereas if you're doing a perio procedure and you're into the pocket, you can actually stick the laser tip through and see it through the gingival tissue, and that's a great use for it because it sort of helps you visualize where that tip's going down into the pocket. Now, so when we talk about initiating and the act of initiating, there's different ways to do that. We can initiate by utilizing occlusal paper. In this case, cork contains cellulose, which also contains pigment, or we can actually use a Sharpie marker, which has pigment, and actually paint the end of the tip. Which one's better? People have personal preference. I prefer the cork. In order to initiate, we want to be at about 1.5. That's sort of a good place to start. And what we're going to do is either by initiating with a cork, we're going to just let the cork or the laser tip fall into the cork, and you'll see a little poof of smoke. Slowly bring it out. You'll notice now when I hit the laser, there's a different glow, a different color. That's usually a sign of initiation. But the ultimate sign of initiation is that we are going to cut. Now, with all diode lasers, you have to give it a few seconds because it takes a few seconds for the tip to heat up. So let's see if we were initiated properly. We're now at 1.5, and obviously see after a few seconds we are cutting away, and we're cutting quite efficiently. Okay? So, what about utilizing occlusal paper? Occlusal paper can be utilized to initiate by just rubbing the laser or the end of the fiber on the occlusal paper. You'll see it'll start to smoke a little bit, and that's another way to pick up pigment into the end of the tip. Or you can actually use a Sharpie and just sort of paint the end of the tip with the Sharpie. That's really the ways you can initiate. They all work, but just be sure that it's properly initiated, and the ultimate sign that it's properly initiated is that the laser is cutting. And as you can see, we have a nice cutting effect here. Now, as you can see, we're getting a little bit of charring. We'll talk about charring in just a minute and how we can eliminate charring, or at least minimize charring, so we don't get that burned effect. You have to remember the laser's cutting by vaporizing tissue. And it has a sort of a low area of vaporizing, but it still can create some charring. Now, in order for the laser to cut, it has to interact with tissue. As you can see, the faster I move, the slower it cuts. The slower I move, the faster it cuts. The pressure that's put on is very light. You don't gain anything by pressing hard. Very light contact and slow motion. Okay? Now, we're at 1.5 watts. Let's actually turn down a bit and see where we can start achieving some cutting. Now at 1 watt. We're still cutting on the pig jaw. If I move slow, I get a nice cut, even at 1 watt. So, try to start out by utilizing a nice low setting. Remember, you can always turn the power up. Let's go ahead and cut at 2 watts. Obviously, we're cutting faster, and you can see a bit of a difference. If we cut at a higher power setting, you move the tip a little faster, and that will give you the result you want. What about cutting at a pulsed mode? So let's go to a pulsed mode. Now we're at 2 watts, we're at a 50-50 duty cycle, so we're actually cutting in a pulse mode, but our actual average power would be 1 watt. You can see the laser flickering because it's firing on and off. Now, while it looks like it's not cutting as much, you'll find that we actually are cutting, but you get a lot less charring with a pulsed mode. You get less charring because the laser's firing. It's firing on, off, on, off. It's producing heat, it's then resting. Heat, cool, heat, cool. Because of that interaction with the tissue, you get less charring, and that's a nice use for maybe an anterior tooth where you want to do some cosmetic sculpturing or aesthetic sculpturing to get a nicer gingival effect. Whereas if you have thicker tissue, maybe in the posterior, you might have to bump your power up. Now, the most important thing you can realize when you're cutting is how the laser interacts with tissue. If you move too fast, you're not going to have the laser interacting with the tissue, and you're not going to get the effect or the cutting you want. If you move too slow, you might get a little excess charring and also not get the result you want. So you have to realize that by adjusting your speed, that's how you're going to learn how to use your laser most effectively. Now what about using the laser and actually trying to cut a little with the side? Say we want to remove gingival tissue. In this case, let's go back to continuous mode and let's go to 1.4. You're going to find almost all of your cutting is between 1 and 2 watts. What's going to determine how high of a setting you need to use? Well, look at the tissue. Is it very fibrous? Is it thick tissue, or is it a thin tissue? Is it inflamed? Is it healthy tissue? All these things are going to help guide you to determine most effective cutting. So let's see if we can take a little tissue away. So we're at 1.4 watts. We're going to do like a little, say we had like a class 5. I'll take that tissue away. Now I'm going to go down right along the tooth. And actually take that tissue away. And you can see that I've actually taken that tissue away. But now I want to use the side of the laser to actually create a little bevel or contour to the tooth. So I'm laying it now, laying it down. I'm actually going to use the side and bevel that tissue so I get a smoother result. Now, as we use the laser, we have to remember that we're going to get buildup on the end of the tip. The buildup on the end of the tip can be easily removed by just pulling straight back with a wet 2x2. By utilizing this, we are not going to remove the initiation, and we should not need to reinitiate, but it will help clean and remove a little bit of that excess tissue that's clinging to the end of the tip as we use it. So still we're at 1.4. You can see that this laser is very, very efficient at cutting. And at this 810 wavelength, you're going to find that it's going to cut very quickly. Now, we do get a little charring along that tissue. And again, we could take a 2x2, either using water or peroxide. Give that a little rub there. And you can see it cleans it up very beautifully. There's virtually no charring left by just giving that a little rub to remove that superficial charring that occurred when we're utilizing the laser. So let's go now into a pulsed mode. So we're in a pulsed mode at 1.4, which would give us an average power of 0.7. You can see we're getting a lot less cutting, not as quick because our power is a lot less. But sometimes that's a nice way to finish up and contour tissue. Or it's a great way to do a little troughing, clean out the sulcus, and expose your margins. So see how I'm just changing the angulation of the tip to interact with the tissue and get the result I want. Varying the speed and angle of the tip, and get a very nice clean result. Maybe just a little rub there to remove, and you can see there's no charring. Get really, really nice result. That would be a great indication for a class 5 to expose a root surface, expose some subgingival decay, or like I said, by adjusting the power down to actually do a little troughing prior to taking your impression. Now, what else can we do with our laser? And obviously we're doing this on the pig mandible. We will have some demonstration videos on patients with voiceover that will explain the technique and procedures. And then as you get into the further course, the online course, you'll find a lot more references, uses, settings, procedures and with voiceovers that'll help you even further to continue your journey and to incorporate your laser into your practice. So now that we've finished the procedure, how do we take care of the tip or the laser, and also what do we do? How do we know when that tip is no longer of use? Well, the tip is going to degrade over time. The more energy you put into the tip, the faster it will degrade. So if we pump this up to 5 watts, you would probably see that tip degrade a lot faster. Once the tip, or we're done with our procedure, what we would do is we could just advance that out, and we would just again cleave off, strip part of the plastic coating, cleave off that glass fiber that's used, expose a new non-initiated part of the fiber. That way we'd go through again to initiate. The plastic tip be thrown away. The cleaved part of the fiber would go into a sharps container, and then we'd be ready to go. So in summing up what we just covered in this section, the most important point is probably how the laser interacts with the tissue. As you can see, it's very important to properly initiate the tip. If it's not properly initiated, you're probably not going to see any cutting. As we increase the setting, the power, we're going to have more interaction between the laser and the tissue. And it's going to lead to a little more charring of the tissue. So it's certainly you have to look and see what you're trying to achieve. If you just want to zip a little tissue away real quickly, you might want to go with a continuous mode. Zip it away, you might get a little more charring. If you want to do a little finer cutting, maybe an anterior little recontouring, gingival recontouring, you might want to go to a pulse mode where you'll get less charring. Either way, remember to properly place the tip in contact with the tissue. The slower you move, the faster you cut. The faster you move, the slower you'll cut. Clean the tip. It will not remove the initiation, but clean the tip with a wet 2x2, just water, to remove any excess debris. And then when you're done, you can use a wet 2x2 with either water or peroxide to remove any of the slight charring that may occur. As you've seen on the pig model, the precise LTM cuts very, very effectively at even low power settings. So start at a low power setting. You can always bump it up. Practice a little. You can practice on if you don't have a pig mandible laying around, you can practice on a hot dog. You can practice actually on a tomato. And just move slowly, adjust the power, go between pulsed and continuous. Have a little fun with it and see what kind of result you get. Then when you start on your first patient, just remember, start low, make sure you're properly initiated, and think about what you want to achieve prior to starting.